All right, I guess we'll get started. I'm Steve Kossor. This is the 5th year in a row I've been invited to AutismOne by Terry and Ed Aranga, and I'm thankful for every one of those opportunities. This meeting consistently presents some of the most amazing science that exists on the planet insofar as the treatment of disabling conditions, in my opinion, in children especially. So I want to say thank you for all of you who've come here today, and I hope I can help you figure out how to get funding for the treatment that you've learned your children need. And that's the purpose of my presentation today. I want you to understand that the treatment funding that your children are entitled to is in fact a civil right. It's not something that you should get because you have a job. It's not something that your children should get because they're hurt. It's something that your children who are disabled are entitled to as a civil right conveyed through the Social Security Act and the Medicaid Act. And all your children need to do is enroll in the Medicaid program in order to have access to that funding. Medicaid, everybody thinks, is for poor people. It is not. Medicaid funds treatment services for children under the age of 21 as long as they're enrolled in the Medicaid program. I'm talking about the EPSDT benefit, early and periodic screening, diagnosis, and treatment. If you're enrolled in Medicaid, you are automatically entitled to EPSDT funding that is, and this is a quote from federal law, that is sufficient in amount, duration, and scope to reasonably achieve the purpose for which it, that is the treatment, is furnished. Now that's federal law, that's a civil right because it's part of the Social Security Act, part of Medicaid, and it was made a mandate across the United States in 1989 by an act of Congress. So anybody who says, no, we don't do that here, is lying to you. Now wait, there's one caveat. A child can be enrolled in Medicaid in all 50 states if they are below the federal poverty level, if their family income is below the federal poverty level. But in 30 states, if you live in one of those states, that's 3/4 of the United States, you can be enrolled in Medicaid as a family of 1. And your income at the tender age of 7 determines your eligibility for enrollment in Medicaid. Guaranteed you're not making above the federal poverty level if you're 5, 7, 9, 11, and this is birth to 21 actually. So any person living in one of those states can enroll in Medicaid regardless of how rich or poor their parents are. It's an important take-home message. So Medicaid is the #1 insurance plan for children all over the United States. It is the largest support that our government provides to the citizens of the country. So what I want you to understand is that once a child is enrolled in Medicaid and then is eligible for this EPSDT funding, the federal government, the Office for Civil Rights, the Justice Department, can then step in between you and your child and the forces in the state government, the county government, the insurance companies who want to take your child's civil rights away, including your child's access to treatment funding. So you enroll your child in Medicaid as fast as you possibly can. And as soon as they're enrolled in Medicaid, they're going to have access to a wealth of funding for a wealth of treatment programs. And my purpose in coming here today is to describe to you just how robust those treatment services are. Now, I have about an hour today, and I normally present this program over the course of several hours. So what I'm going to do is we'll go to the first slide, and I want you to be aware that that is the website for the Institute for Behavior Change. This is the organization I created in 1996. It's a nonprofit foundation. And what it does is it gives access to information, truthful information, about mental illness, its treatment in children, and the means of funding that treatment, how to be an advocate for a child with a mental illness so that they can obtain and retain funding for the treatment of their condition, especially through Medicaid. Now you see on the top toward the right below the balloons it says, click here to learn about us and what we do. If you go to this website, and the URL is www.ibc, hyphen like a minus sign, PA like Pennsylvania.org. If you go to that website and click on that link, you're going to watch a 2-hour video of a program that I presented at the National Federation of Families meeting in November of 2014 that describes what we do. It talks about our programs and all of the interventions we've created. It talks about funding through EPSDT and Medicaid, and it talks about how to advocate for your child through the Office for Civil Rights. I'm not going to repeat all of that stuff. I'm going to do a talk today that amplifies and goes beyond that. So by all means, go there, watch the video. It's shot in relatively high def, so you can stop it, print pages out, and follow up on it. Right below that, you'll see a thing there that says Our Values. And below that, let's just see 5 values that we live by. If you click on the statement that says Our Values, you're going to be able to download a paper. It's a 1-page paper that will tell you how to know if you are getting the most effective services for your child. It's a philosophical belief that we have. First of all, your provider has to know what the truth is. They have to seek it, and then they have to tell it. If they don't know what it is, you need another provider. In other words, if you find out something in your thoughtful, conscientious search for the truth, and your provider says, oh, no, I don't agree with that, you need a new provider, families. You just plain need somebody who believes what you believe based on your own independent scientific study of the truth. You don't ever rely on somebody who has a tie and a jacket to tell you what the truth is without checking it yourself. There are too many liars, fraudsters, criminal types, people taking advantage of you in the world not to check things out for yourself. And when there's a disconnect between what you believe and what they believe, you'd better get another provider because you're never going to get the treatment that your child needs on that basis. The second thing is share fairly. You're supposed to share the responsibility for treating your child with your treatment provider. Anybody who says, Mom, take it easy, go to the spa, we've got this. You can't do that. You have to be involved with it. You're supposed to help others. If they're not helping, they have no business being in your child's life. And you evaluate whether or not they're helping on an ongoing basis, not once at the start and then hope for the best. You are supposed to be thankful for them. They're supposed to be thankful for you. It's a two-way street. And finally, you're supposed to both be moving forward. They're supposed to be learning more about your child's condition and its treatment as time passes, and so are you, so that ultimately your child's moving forward. You don't want to pay a spectator. Anybody who's content to be a spectator in your child's life is taking unfair advantage of your child in a parasitic kind of a way. So that's my take on the overall philosophy of treatment. So let me go into a very rapid-fire presentation now. You can watch the video and click here to learn more about us and what we do at your own pace, at your own time. I want to get to the other stuff where we're talking about advocating for the civil rights of your child and preventing people from taking them away from you without a very vigorous fight. All right, by way of introduction, this is a letter from the CMS, Cindy Mann. She just left. She's replaced by another lady. But Cindy, in July of 2011, wrote this letter to my state representative and praised what I do. It was just, it's phenomenal. They never write an endorsement letter, but they actually commented and said, my staff has spoken with Mr. Kossor, and we learned that he has indeed developed an effective approach to serving children and adolescents with developmental disabilities and has made the approach available to Medicaid-enrolled children through EPSDT. So it's literally, it's not an endorsement, but it is an acknowledgement, because I've shipped everything I've proposed to the Centers for Medicare and Medicaid Services, and I have not gotten back a statement, hey, don't do that, that's not true. In fact, I've gotten letters just like this. The services that we're talking about were described in a letter in January of 2001 from the Department of Health and Human Services, in a letter where they say state Medicaid programs must make EPSDT services promptly available for any individual who's under the age of 21 and who is eligible for Medicaid, whether or not that individual is receiving services under a waiver or some other state plan. It really is important to understand how far back this goes, and it predates 2001. In actuality, EPSDT started in 1967. It's been around for almost 50 years. In that time, it has offered a guarantee of treatment funding for all of these items. Treatment and prevention services. Actually, it should say prevention and treatment, because prevention is the #1 purpose of EPSDT funding. It funds health services in regard to physical, speech, and related therapies, hearing services, eye exams and eyeglasses, durable medical equipment, home, residential, and inpatient care, dental care, and other services, including mental health care. All of the stuff you've heard about applied behavior analysis, it's funded under EPSDT. Absolutely guaranteed. I've been billing EPSDT for 19 years for the delivery of ABA treatment to children, and it has cost their parents absolutely nothing, regardless of the family income, because I do treatment in Pennsylvania, and Pennsylvania is one of the 30 states where you can get treatment funded under EPSDT regardless of family income. EPSDT is enumerated in the Social Security Act, which makes it a civil right for the children who are affected by it. Understand primarily that every service under EPSDT has to be sufficient in amount, duration, and scope to reasonably achieve the purpose for which it is furnished. Who determines the purpose for which a treatment program is furnished? I'll give you a quick clue. It's not the character employed by an insurance company to read my report and make an opinion as to whether or not the kid deserves it. It's the licensed practitioner who observed the child face-to-face, rendered a diagnosis, and prescribed the treatment plan. If the licensed professional does that correctly, it will be funded under EPSDT because of that clause. If it's written ineptly, the insurance companies will be able to chisel away at it and detract from it and basically make it go away. So I can help licensed practitioners in all 50 states to know how to write these prescriptions correctly. I can also show them how to write treatment plans that will get approved, just like I've written treatment plans for 20 years. In fact, for the whopping fee of $65, you can go to www.treatmentplans.worked.com, ED. And you can download 576 behavioral treatment plans that work with the data that shows the that they were effective. And the strategy here is you approach a licensed professional, a licensed psychologist, a psychiatrist, pediatrician certainly, and you say, I would like you to do an evaluation of my child because I want her or him to get the same treatment program that this guy documents in Pennsylvania for 20 years. Here's treatment plans that work. Find 16 plans for girls between 9 and 11 who were biting, etc. And I want you to write a treatment plan that meets these same standards. Here's the guy's number. You can talk to him. He'll consult with you as a case manager, certainly not as a psychologist. And he'll help you craft your evaluation and your treatment plan for my child in a way that gets it funded by EPSDT. So you take that treatment plan to the state Medicaid agency in your state, and you say, my child's enrolled in Medicaid. I'd like this to be funded under the rules of this state. It's a Medicaid program. The state at that point has two choices. They can say, okay, go down to the EPSDT counter, get your funding, bless you, and have a good life. Or they can say, no, we don't do that here, or some variation on that theme. If they take the second course, they violated the child's civil rights, because since 1989, the Congress of the United States said that EPSDT funding, which I use to fund the treatment plans that I'm delivering for 20 years, must be available in every state, whether or not the services covered by that treatment program are funded by any other plan. It can be in an IEP. So what? EPSDT will pay for it. And in fact, the big secret that most school districts don't admit to is that Medicaid is the payer of first resort for services that are covered by Medicaid in schools. Medicaid has to pay for it. The schools have to deliver it. It's a marriage made in heaven. So every school has now enrolled in Medicaid as a provider. They're billing Medicaid for every child with an IEP if they feel like it. Some school districts are a little skitsy about it and they're afraid. Because Medicaid is a cruel taskmaster. If you screw up, they can take money back with both hands. You stay honest, you take data, and you're aware of the law. That's where I really excel. But every year I get an audit and they come looking for bear and they leave with rabbit. And I'm continuing to do this for now 19 years, writing behavioral treatment plans that match or exceed the standard set by the National Academy of Sciences. You know what that is? That's an organization chartered by Congress 150 years ago to advise Congress about matters of science. You know what that agency says the minimum necessary treatment program for a child with autism spectrum disorder symptoms? It is 25 hours of intensive, individualized treatment every week. Monday through Friday, Monday through Sunday, over the summer, down to Disney World. That's the minimum, 25. If a child has a more severe deficit complicated by an intellectual disability, it should go higher. The American Academy of Pediatrics in 2007 and 2012 found the exact same standard. So what happens when an insurance company says, in response to my prescription of 25 hours of treatment, oh, no, that's ridiculous, he only needs 5. I'm not driving a tack with a sledgehammer when I ask for 25. I'm asking for the minimum that the National Academy of Sciences and the American Academy of Pediatrics have said is the minimum. I'm not asking for anything exorbitant. If they tell me I only need 5, that is what I call driving a tack with a toothpick. you're going to break a lot of toothpicks and you're not going to ever drive the tag, right? And this is a clever way for insurance companies to prove that, see, we were right. It was a waste of time. This BHRS thing doesn't work. And the sad, I guess it's a secret truth, but I'll tell you what it is. Insurance companies get a load of money at the start of the year, $100 million, to serve all of the needs of the kids under their supervision in that year. If they only use $70 million at the end of the year, what happens to $30 million? Well, the insurance company gets to keep a third, the state government gets to keep a third, and the county government gets to keep a third. So all three of those entities make bank if they ask for this much and only deliver this much. Okay, this is how the insurance industry works, how state governments work, how county governments work. And the end result is, because of that system and its failure to deliver mental health treatment adequately to children, I filed a civil rights complaint in December of 2012 against the state of Pennsylvania and all of the managed care companies dealing with Medicaid funding in the state. Around January of 2014, so about 13 months later, I got a letter from the Department of Civil Rights, the Office for Civil Rights, saying, okay, we've made our inquiries, we want to see more evidence that this is really true. So I sent them more evidence. I got permission from the families I've been treating, where they testified to how bad they had to fight until they met me to get these services for their child. Okay, some advocates sent in stuff, so the Office for Civil Rights got a whole bunch of, maybe 20 cases, and they are still investigating it to this day. The Centers for Medicare and Medicaid Services is also concerned about how the EPSDT mandate has been administered in Pennsylvania, and they're also doing an investigation. So the short version is, Pennsylvania is widely understood to be one of the most liberal states in the nation as far as the administration of Medicaid and EPSDT is concerned. If the OCR, Office for Civil Rights, and the Centers for Medicare and Medicaid Services conclude that Pennsylvania needs to up its game, what does that mean for the rest of the country? Everybody has to do a better job to comply with the Social Security Act and the Office for Civil Rights standards about not impeding the civil rights of children with disabilities who are enrolled in Medicaid. This is big-time stuff, because any of you who have a child, if you enroll your child in Medicaid, regardless of how wealthy you are, if you're able to do it, do that, because that will give your child an access to funding that cannot be taken away at the whim of a state government, at the whim of a county government, at the whim of an insurance company. They can't, because it's EPSDT, and it's a civil right under the Social Security Act. We can go into how Medicaid funds education funding. The thing to remember about the education system is, and this is an example, this is a memo written from the Department of Public Welfare, which was the state Medicaid agency, to the Department of Education in Pennsylvania. And what it says, this is a quote, "The health-related services a student receives through the school-based access program," that's how the schools tap Medicaid, "are separate and apart from the medical assistance, MA, or Medicaid services a child receives outside of the school setting. Medicaid is like a keg with two taps. It's got this massive tap in the back that nobody ever sees that funnels into the school. It's $140 million in Pennsylvania 2 years ago. Those were the last statistics they released publicly. $140 million a year. And that's times 50 states, times 10 years. That's $5 billion of Medicaid money flowing into the schools. But while it has that enormous tap that is utterly unregulated coming out the back, there's a spigot that comes out of the top of it. And this is Medicaid money that parents who know their rights under the law can tap. And you can have that Medicaid money flowing into your child's life, where my staff can go with your child to the school, to the church, to the daycare, any of these places, and over time, gradually get farther and farther away until your child's autonomous and doesn't need help anymore. 90% of the kids we treat are finished in 3 years or less because they start getting better almost immediately. 4 independent research people at 4 different colleges looked at our data and they all came to the same conclusion. Data is data. No matter who analyzes it, if they're truthful, they're going to say what it says. So 75% of the kids we treat show improvement in 4 months or less. So they know they're getting better. They have a reasonable probability of getting better. And this letter was created by the Department of Public Welfare in Pennsylvania to assure parents that if they sign the papers opening up Medicaid into the school, that this is going to have absolutely no effect whatsoever on the stuff coming out the spigot, 25 hours a week in the home, or the school, funded to the child. I bill the insurance company, they curse at me, and they write the check. I can stand it, you know? The bottom line is, it's an entitlement under the civil rights dome. And whatever the school is doing has no effect on what's available to the parents, to the child in the home or elsewhere. There's no cap. Now let me just make sure you're clear about one thing. This is a box of breath mints, right? There's 50 of them in here and they're all free. But when you're gone, they're gone. There's a waiting list. You get online, there's only a limited number of these available, and it may take a few years for you to be able to get up to the front of the line and get your box of breath mints. That's a waiver. You don't want a waiver. You want EPSDT, which is a lot like a wallet full of credit cards with your child's name on it with an unlimited balance. And I'm not kidding about unlimited. Read the last paragraph. Additionally, there is no cap or limit on the total amount of money that may be paid by the MA program for school-based access services or medical assistance services that the MA-eligible child may receive. This is the greatest treatment funding secret ever concealed. What should you do when you discover that access to medically necessary treatment is being systematically denied to children with disabilities who are enrolled in Medicaid, which is a violation of their civil rights? What should you do when an insurance company is doing it, or a county government, or a state government is doing it? For example, these are just things that were in the master plan to redesign behavioral health in Pennsylvania until I filed my civil rights complaint. They were going to pay providers more if they prescribed less, and pay them less if they prescribed too much treatment. Too much was more than 10 hours a week for a child with a severe disability. They said they were going to exempt children with autism, but whether or not that matters is really a critical ethical question. It's against federal law to discriminate against people on the basis of their disability. So if you cut the kids with autism a break, what are you doing to the kids who have ADHD or something else? You're discriminating against them, and that's illegal. So you can't cut a separate break for the kids with autism legally, in my opinion. I'm not a lawyer. I'm not trying to give legal advice here. I'm just trying to raise questions that need an answer. If you require that evaluations can only be done by prescribers who all miraculously prescribe less, can you do that? If you penalize prescribers who deliver too much treatment, even though it meets the Department of Public Welfare and National Academy of Sciences and American Academy of Pediatrics standards, can you do that? Can you actually pay them less if they meet those outside standards? If you refuse to establish or enforce your own standards for insurance companies to use in determining what is medically necessary, are you not abrogating your responsibility as the state Medicaid agency? And when you have people like me asking questions and they refuse to return phone calls, what can you do? But it's even more pernicious than that. What happens when your child's treatment provider is actually taking orders from an insurance company? And this is the most harrowing stuff that I've ever seen. These are actual quotes from a BHRS provider. Well, the MCO feels that this level of TSS, and that would be over 20 hours a week, indicates that he needs a different form of treatment. Really? Now we've got an insurance company prescribing what a kid needs? On what planet? Well, the MCO is highly scrutinizing any case that has a substantial level of TSS service that occurs in a specialized classroom due to the definition of the service. What? Well, the TSS's primary role, TSS is therapeutic staff support. It's a bachelor's level person who goes into the home and school with the kid, follows them around, corrects them, keeps them pointed in the right direction, and by the way, also creates a force field that repels the more pestilential influences surrounding the kid in the classroom. The TSS's primary role is to teach, model, and transfer skills to existing caregivers, that is, their parents, teachers, and school aides, in order to fade out. That's their primary role. This is like saying to a parent, look, I'm going to give you this penicillin, but I can't have you fill the prescription until you learn how it works. Right? You have to understand the chemistry and the medicine behind it. And in order for you to keep getting it, somebody else has to become trained in that in addition to you if you want it in the school. Ludicrous, right? Nobody would stand for that. But this is what this professional told the parent and the teachers about how the system works. It gets worse. This is a quote. This is just the reality of the situation, and our job is to follow through with these recommendations. These are recommendations by an insurance company. So the question is, who does this person work for? They say, quote, the concern was raised in a county grievance. Wait a minute. As a child or a parent caregiver of a child, you have the right to grieve an insurance company's finding. The county doesn't have the right to grieve anything. They hire the insurance company to do their bidding. They don't feel, and that is the county doesn't feel like enough attention has been paid to titration. Titration means watering down, to sane people. To government officials, it means reducing the number of hours. Now, if I'm here next to the kid providing training, that's a pretty high, intense level of training. What happens if I move back here? Am I titrating? Absolutely. I'm watering down the potency of the treatment. So I'm going to titrate services, and I'm going to deliver them from as far away as I can so that the kid doesn't fall apart. And God forbid he does have a bad day. What do? I'm right here. I'm watching it, and I zoom in, save him, prevent regression, and then I move back out again. So he's never dependent on me. That's idiotic. All right. The other way we titrate services is in terms of a hierarchy. If I take your hand and I guide it through the process of doing the task, that's called physical guidance. That's a really intense level of prompting. What's verbal prompting? What's gestural prompting from across the room? What's a to-do list? and monitoring. So we try to lower the intensity of the prompting, do it from farther away, and that's titration that makes sense. The insurance companies in the state and the county only want services to be titrated by time, which is utterly it's indefensible. You can't do it that way. So the child's doing well on Monday, he's done well every week for maybe a month. So now you're going to cut him from 20 hours a week to 10 or 5, whatever. So what happens when you're off and he has his horrible day? That sets him back for a week. But wait, you already cut it back to 10, so it'll take you another 4 weeks to get the machine working again, to move it back up, and by that time, he doesn't need 10, he needs 30. Okay, so there's all those things that go in. So instead of understanding all that, the professional says, it's a frustrating reality as services continue to shrink. Wait a minute, you're making them shrink. You're part of the problem. You're not even close to being part of the solution. And finally, the MCO is increasing pressure on districts who use high levels of TSS for students to justify why a school aide or a personal care assistant would not be a more appropriate intervention. Are you kidding? That's the school. They do their thing. We're talking about mental health treatment, which is not synonymous with education. They are separate entities. They can't overlap. But this person is telling the poor parent or the teacher, no, they can't. The school has to do a better job. And the really sad part is the Department of Public Welfare in Pennsylvania has issued statements to the insurance companies for almost 10 years, repeatedly saying, you can't do that. And here's this woman telling the staff of the school that, yeah, they can, they have to. So who's supporting that? Does anybody think the state government is encouraging that behavior? They certainly are, by simply not objecting to it and issuing a final bulletin to clear the air once and for all. So anyway, the bottom line is your child's treatment provider should work for your child, not an insurance company. Your child's treatment provider should know the laws and regulations that govern the delivery of treatment services and should object when they are being violated. That's what an ethical professional does. Ignorance of the law is no excuse for violating a child's civil rights by depriving them of treatment that is, quote, sufficient in amount, duration, and scope to reasonably achieve the purpose for which it is furnished. That rationale for treatment exists nowhere else except the EPSDT mandate. That's why you need to enroll a child in Medicaid if you possibly can, so that the federal government can defend the child's civil rights when insurance companies, and state governments, and county governments, and others, including some of the prescribers and professionals that are hired by these characters, when they all try to chisel away at your kid's civil rights, you need a big dog in the fight, and that's the Office for Civil Rights. So how do you access the Office for Civil Rights? They're online. On Christmas Eve of 2012, shortly after that kid shot all of those children up in Newtown, Connecticut, I had had enough. I said, I can't stand this anymore. They're going to do all this stuff to take away these treatment for these kids. Children are going to die. Parents are going to die if this doesn't stop. So I went online and I read, wait a minute, I'm a licensed professional. I'm required to raise a complaint about the violation of civil rights if I'm aware of it. Ooh. I called the Office for Civil Rights and confirmed that. And I said, you know, I think I should do this. Don't you agree? And the woman chuckled. I said, what's funny? She said, you'd be the first one who ever did that. Did you ever hear the story about biting the hand that feeds you? Come on. She was trying to be helpful. And I said, listen, you don't understand. I'm not biting a hand that's feeding me. I'm biting a hand that's trying to take away the life substance of children I care about. They deserve to be bitten because what they're doing is wrong, it's immoral, it's illegal. Wait a minute, it violates the kid's civil rights, doesn't it? And she said, yeah, pretty clearly. So I went onto that website, and right over there in the corner, it's how to file a complaint. Click on it, and you'll see a little form that comes up. But bottom line is, I filed a civil rights complaint that said, disabled children enrolled in Medicaid in Pennsylvania who are prescribed BHRS treatment, behavioral health rehabilitation services, under the EPSDT mandate of the Medicaid Act that meets all of the criteria for the definition of medically necessary treatment, are denied funding for that treatment by behavioral health managed care organizations and Department of Public Welfare, who claim that the prescribed services are not medically necessary. All you have to do is look up the definition of medically necessary treatment, and you'll realize that treatment is medically necessary if it prevents the worsening of a child's condition. Okay? Or if it treats the child's condition and the child seems to be showing some progress in the treatment, or if it maintains the child's functioning at a level commensurate with those of similar age with similar disabilities. Oh my God, you could drive a bus through that definition, right? Any of those things make it medically necessary. So how in God's name does an insurance company say, when I prescribe treatment for all three of those reasons, how can they say it's not medically necessary? The answer is they can't. But everybody else who's doing it in this state just assumes that they have that authority. None of my competitors include the definition of medically necessary treatment in their prescriptions, and I'll leave it up to you to figure out why. So 90% of the children served in the United States by mental health professionals are having their civil rights violated if they're enrollees in Medicaid, and nobody's doing anything about it. And you as parents can actually change that equation just simply by contacting the Office for Civil Rights and filling out a complaint in accordance with the terms that I use. You just have to look up your state's definition of medically necessary treatment. Every state has a slightly different one, but they're all basically there. I can help you look it up. I can help you find it. I can help you as a case manager craft the filing of a civil rights complaint if you feel your child's civil rights have been violated by the county, the state, the insurance company, or anybody else, especially civil rights to treatment funding. There was a Supreme Court complaint raised by a group in Idaho who said, look, you guys are paying us with 1999 pay rates. How can we possibly recruit staff, pay them? We can't do it. And the Supreme Court said, that's an issue between the state government and the federal government. So what, the providers can't complain? They can't, they have no standing. But what happens when the providers file a civil rights complaint on behalf of their clients that those children's needs are not being met because of the intractable position and obstacle created by the lack of funding? Now you got a way bigger dog in the fight. You're not arguing with the state Medicaid agency. They'll do what they can, and the feds will do what they can to keep everything on the down low until you throw gas on the fire, and then things start happening. One of the best things about a civil rights complaint is that once you file it, a bell of protection descends over you by the Civil Rights Act. You cannot be subjected to reprisals, threats they're going to take your kids away for some cockamamie reason or whatever, alleging that you have Munchausen's by proxy. If you look in the Medicaid Act, under the definition of EPSDT services, it's that list, and it includes mental health services, hearing, vision. All of these services are funded under EPSDT as a civil right. I'm an expert in behavioral treatment. I can design a behavior treatment program. And it doesn't matter if the kid is in the school or in the home, where they are, EPSDT can fund it. Some schools don't bother asking for EPSDT money up front. The billing office takes care of that. So sometimes the teachers don't even know.
So how do you find out if the school district is getting those funds? Because there's no way, I mean,
In my state, I can call Medicaid and get a list of everything that's been billed for my daughter, and that's how I know my district is billing for those services.
Yeah, that's right. You can ask on your per-person basis for an
You can find out
accountant.
if they're billing for it.
And
Yeah,
that,
and in Illinois, they can't bill unless you give permission.
Right.
well, that's actually a federal rule.
Right, but I mean, Illinois is very strict.
Yeah, but the whole point of it is, there's a federal rule, and we got 30 seconds, 29, 28. There's a federal rule that says that the services have to be delivered. That's the Individuals with Disabilities Education Act. That act doesn't say the school has to pay for it. The Medicaid people have to pay for it if it's a covered service in schools, but Medicaid can't be billed without parental consent. So you have to sign off on it to permit them to bill it, and that was the purpose of that letter from the Medicaid agency to the education agency saying, "Good, you can sign it, don't worry, you won't lose anything." Okay, I can't take another question now, but I'll be here until Friday. We can talk at your leisure.
Okay.
I'll be out in the vicinity of the restaurant out front, so look me up, okay? Thank you so much.
Hey.